Good day, everyone. Welcome to our rationalization for our LT2 and Nloa 1. And this is going to be the focus of our discussion this day. And I'm actually in charge of discussing the answers of 25 items, and 12 of these is actually about pregnancy assessment, nutrition, and family planning. And the remaining 13 will be for uh, subcategory C3. Let's begin with question number one. A 30-year-old woman and her spouse attend an infertility clinic. They have no children and have had several appointments with a physician regarding their infertility problems. To improve sperm production, the nurse should instruct the client's husband to avoid which activities. Select all that apply. Number one, swimming in chlorinated water. Number two, sitting in hot tubs. Number three, wearing boxer shorts. Number four, wearing colored underwear. Number five, smoking cigarettes. And number six, refraining from strenuous activities or refraining from strenuous exercise. So this is actually a SATA question. So our test taking here is for us to analyze to determine what specific information the question asks for, which is actually a technique for increasing our technique for increasing sperm production. And since this is actually a select all the right question, therefore it requires us to independently check or decide whether some of these are actually important in avoiding uh, the activities that needs to be avoided. And of course, we know that we can actually recall activities that can possibly talk about temperature around the scrotum that could possibly decrease sperm count, and at the same time smoking, as it actually lowers the sperm count by approximately more or less 23%. That is usually associated also for damaging our nucleus of the sperm that could possibly cause chromosomal abnormalities. Therefore, we're not going to be eliminating choices. Number six, we have to eliminate, we have to include that, no? We have to avoid strenuous exercise because we know that strenuous exercise can also change the temperature of the testis, and that is going to be a big problem then. The number five, as what I mentioned earlier, 20% can actually affect the patient, especially for the uh, sperm counts, and at the same time sperm motility. The number four, it doesn't necessarily is important, especially when it comes to wearing colored underwear. The number three, wearing boxer shorts, does not have any impact at all. And then last thing is your number two, sitting in hot tubs, because of course that is actually very significant for us to take into consideration because it can possibly damage or kill the sperm. Therefore, man should actually avoid utilization of hot tubs or probably taking hot showers, especially because you are preventing this infertility. And one more thing is that tight fitting clothing, such as jeans or briefs, may also have the same effect by trapping body heat and elevating the temperature of the testes. But of course, we can actually wear boxer shorts. And swimming in chlorinated water doesn't have any impact at all, especially for the sperm count. We know also that testosterone production is changed during strenuous exercise, which may cause a decrease in sperm formation. And swimming does not affect the viability of sperm. So the answer for number one here is 2, 5, and 6, excluding 1, 3, and 4. So the answer here is letter C. Number one, the answer is letter C. And that's the answer. I've mentioned that one already. Number two, the physician informs the client that pregnancy is confirmed based on blood tests and Chadwick sign, which was positive during the pelvic examination. After the physician leaves, the client asks the nurse to explain the significance of a positive Chadwick sign. Which response by the nurse about Chadwick sign is most accurate? A. It's the spontaneous occurrence of intermittent painless contractions that begin early in pregnancy and continue throughout the entire period of gestation. Letter B, it's a bluish discoloration of the cervix, vagina, and vulva that occurs as a result of the presence of an increased number of blood vessels. Letter C, it's a softening of the cervix that occurs because of an increased amount of blood flowing to the reproductive organs. Or Letter D, it's a dark brown line extending from the umbilicus to the symphysis pubis that occurs as a result of hormonal changes. Of course, if you're talking about choice letter D, that is actually focusing on linea nigra. And of course, if you're talking also about letter C, that is actually about Godot sign. No, so Godot sign is actually, sorry for the background, is a softening of the cervix, and of course, that is letter C. And of course, as I have mentioned already earlier, that letter D is actually linea nigra. It's actually the dark brown line extending from the umbilicus to the symphysis pubis that appears on the skin of many pregnant women. So it's between A or B. So the best answer here is, of course, letter A is wrong because that is considered to be your Braxton Hicks contractions. So these Braxton Hicks contractions are considered to be spontaneous and are considered to be intermittent contractions that occur during the pregnancy. So best answer for number two is letter B. So this presence of bluish discoloration of the cervix, vagina, and vulva caused by the increased in vascularizations of the reproductive organs. So answer for number two is letter B. That's letter B. Number three, before leaving the clinic, the client asks the nurse about the schedule for next few perinatal visits. The nurse responds that for clients with uncomplicated pregnancies, it is usually best to plan monthly visits for the first 28 weeks and then more frequently visits following which schedule. A, weekly for the remainder of the pregnancy. B, every 2 weeks for the remainder of the pregnancy. C, every 2 weeks up to 36 weeks. Then weekly for the last month. Or letter D, weekly up to 36 weeks. Then twice weekly for the last month. So here we're talking about the prenatal visits. So of course, since the patient here is having an uncomplicated pregnancy, so it is actually best for pregnant woman who is actually experiencing no complications to visit the healthcare clinics every 4 weeks. No, so it should have to be every 4 weeks for the first 28 weeks. So that is for the first 28 weeks, and then the remaining will actually focus on every 2 weeks for uh 28 to 36 weeks, and then 36 weeks beyond 36 weeks, 37 to 30, 39, 40, it should have to be on a weekly basis. So letter A, weekly for the remainder of the pregnancy, that's actually wrong because as what I mentioned, it should be every 2 weeks, every month for the first 28 weeks, and then every 2 weeks up to 36 weeks, and then after 36 weeks it should have to be by twice, uh, it should be twice a month, or it should be weekly for the last month. So the best answer for number three is letter C. So it should be every 2 weeks up to 36 weeks, then weekly for the last month. Letter D is wrong because it says weekly up to 36 weeks. That is actually required to have every 2 weeks, and then twice weekly. It should have to be weekly for the last month. Number three answer is letter C. So that is what I've mentioned already, that we have to take into consideration that on the first 28 weeks, it should be monthly, then 28 onwards up to 36 weeks, it should be every 2 weeks, and then after 36 weeks, it should be on a weekly basis. Number three answer is letter C. Four, the client also asked the nurse whether it is safe to continue exercise routinely throughout the pregnancy, which nursing instructions concerning exercise during pregnancy are accurate. Select all that apply. Number one, avoid exercising during hot, humid weather. Number two, avoid any jerking, bouncing, or jumping movements. Number three, drink plenty of fluids before and after exercising. Number four, limit strenuous activity to no more than 60 minutes a session. Number five, perform exercises only in a supine position. Or number six, limit exercising to once per week. So the question here is, which nursing instructions concerning exercise during pregnancy are accurate? So when say accurate, it means that it should be a correct answer. So eliminate natin yung number 6 because it says that limit exercising to once per week. So of course, it is actually expected, no, that the client should be able to tolerate exercising at least 3 times per week, not just once weekly. So she should not limit any strength workouts to no more than 15 minutes per section. So number 6 is eliminated. Number 5, perform exercises only in a supine position. As what I mentioned before, there are options that are absolute. Therefore, if there's a word only always, that's actually going to be considered 95% wrong. So eliminate letter number 5, because exercises should not be done in supine position, especially if the mother is on the fourth month. That is actually to avoid supine hypotension and possibility of insufficient blood flow to the baby. So number 5 is eliminated. So we're eliminating already options A and D. No, I'll be looking at the options later. Then number 4, limit students' activities to more than 60 minutes a session. As what I mentioned earlier, it should have to be 15 minutes, no more than 15 minutes, because 60 minutes is quite long already. So number 4 is eliminated. So we're left with 1, 2, 3. So of course we know that exercises usually raises our body temperature and speeds the metabolism and heart rate. So for these possible reasons, it's very important for us to have this mother carefully monitored so that no harm comes to the mother or the baby. So the nurse should advise the mother to avoid exercises in a very hot and humid weather. That is one way to ensure that our body temperature does not rise and possibly affect the baby. And it's also very important that we need to avoid any jerky or bouncing movement, because that could possibly harm the fetus inside. And one more thing is for us to emphasize that the importance for the client to drink plenty of water before and after exercising to prevent possible dehydration, which can also alter her electrolyte and at the same time temperature, as well as those of the fetus inside the mother's womb. So therefore, she is advised to have the exercise only during the colder part of the day, or possibly if there is an available air condition. Therefore, she should have it in an air conditioned environment. Number 4, the answer is 1, 2, 3, excluding 4, 5, and 6. The answer is Charlie. Number 4, Charlie. Number 5. During a routine prenatal visit, the physician determines that the client in fourth month of pregnancy is not eating an appropriate diet and asks whether she has been taking the prenatal vitamins, folic acid, and iron supplements that were previously prescribed. The physician asks the nurse to instruct the client about the nutritional needs during pregnancy. Before teaching the client about the nutritional needs during pregnancy, which nursing intervention is most appropriate? A. Determine if the client needs to gain or lose weight. Letter B, assess the client's current eating pattern and preferences. Letter C, determine if the client knows how to accurately count calories. Letter D, develop a sample menu that includes the required nutrients. The question here is about most appropriate. Therefore, we're trying to look on the priority intervention of this patient. So, if you're talking about determine if the client needs to gain or lose weight, of course during pregnancy there is a need for the client to gain weight because of the demand of the developing fetus, and then develop a sample menu that includes the required nutrients. So in that case we are on the assessment period because we are trying to focus on before teaching the client about the nutritional need. Therefore it's very important for us to assess. Now when we develop already, that is on the intervention part. And in letter C, determine if the client knows how to calculate or accurately count calories. So, of course, as what I mentioned before, if there are two options that might have the same meaning, C and D has the same meaning because we are talking about required nutrients. It means that you're computing. Letter C, accurately count calories you're counting. So C and D have the same thought. Answer for number 5 is letter B. Assess the current eating pattern and preferences. Because when you're going to be assessing the pattern and preferences of the patient, it's actually one way of assessing before a teaching plan can be formulated and possibly implemented. So once this is obtained, so the nurse can actually show the client that what foods to add or delete in to ensure a balanced and nutritious diet. And of course, there's a need for us to include the patient or the client in the planning process to ensure her cooperation with, of course, possible preferences and choices, and at the same time to advise her on the recommendations of calorie and nutritional requirements, and of course, the equivalencies of the patient's intake. So after initiating this teaching, the nurse can work with the client to develop sample menus to meet her nutritional needs during the pregnancy, regardless of her pregnancy weight, and of course, the pregnant client should gain sufficient weight to meet the needs of the baby. So number five is letter B. Number six. While discussing pre-pregnancy eating habits with the nurse, the client asked, "What's the normal weight gain during pregnancy?" Which explanation by the nurse accurately identifies the recommended weight gain for pregnant who has a normal pre-pregnancy weight. Is it less than 15 pounds or less than 6.8 kilogram, or 15 to 20 pounds? That's 6.8 to 9 kilogram, or 25 to 35 pounds. That's 11.3 to 15.8 kilogram, or no more than 40 pounds, or that's more than or equal to 18.1 kilogram. Of course, we know that the recommended weight gain during pregnancy is considered to be individualized. So we have to take into consideration that the client's pre-pregnancy weight must be taken into consideration, and being small for gestational age is associated with detrimental outcomes for infant but not mothers. So being large also predisposes to harmful consequences for both infants and mothers. So therefore, the guidelines for weight gain for client with a normal pre-pregnancy weight is actually 25 to 35 pounds. That's actually on the entire course of pregnancy. So if there's a weight gain of 28 to 40 pounds, that is recommended for client who is underweight, and the clients who are moderately overweight can gain up to 15 to 25 pounds only. And clients who are very overweight or obese can actually gain 11 to 20 pounds, or 4.9 to 9 kilograms. So just remember, if the mother is actually normal with normal pre-pregnancy weight, it should be 25 to 35 pounds. And if the mother is actually underweight, then he needs or she needs to have 28 to 40 pounds. And if the mother is actually moderately overweight, needs 15 to 25 pounds only. And if there is very overweight, then the mother needs only to have 11 to 20 pounds weight gain for the entire course of pregnancy. Number six, the answer is letter C, 7. During the visit, the nurse also asked if the client has been taking the prescribed folic acid. When the client asks why folic acid is important, which response by the nurse is most accurate? A. Folic acid helps to prevent neural tube defects such as spina bifida. Letter B. Folic acid helps build strong bones for your baby. Letter C. Folic acid helps your baby become resistant to infection. Or letter D. Folic acid prevents your baby from becoming anemic. Of course, we know folic acid is a B vitamin, so that's basically vitamin B9. And the most significant uh, function of our vitamin B9 is to prevent neural tube defects. So number seven, the answer is letter A. So we know that neural tube defects occur especially during the embryonic development when the spinal column fails to close. So in general, it should have to be very important for us to have good sources of folic acid and vitamin B and B vitamins, and that could possibly include eggs, beans, whole grains, and dark green leafy vegetables. So it's very important. And the recommended amount of folic acid for a pregnant woman is actually zero point 0.4 milligram per day. And letter B, that is talking about calcium, because you're focusing on bone formation. Then vitamin A is helping resist infections. And of course, we know that iron is one way of making sure that the fetus is actually going to have enough hemoglobin and blood supply. So number seven, the answer is letter A. Number eight. During a subsequent visit, the nurse notes that the client is eating a bag of potato chips and drinking a diet soda. The nurse revises the client's care plan accordingly, which expected outcome should the nurse include based on the client's eating habits. A. The client will eat three balanced meals and two snacks daily while pregnant. B. The client will gain a total of 50 pounds during the pregnancy. Letter C. The client will take two prenatal vitamins daily. Or letter D. The client will report eating about 2,000 calories per day. So the question here is about eating processed food. No, so we are trying to eliminate two options here. So we will actually eliminate option number letter C, because we know that prenatal vitamins are a medication and does not and the nurse does not adjust the prescription medication. So we should not be adjusting that because that's actually going to be the responsibility of the physician. Then eliminate choice number letter D also is eliminated because we are focusing on calories. So rather than on the eating pattern of the patient, which is on eating nutritious food, and it's not better than, of course, other options. So our goal here is to ensure that nutrition is actually promoted and that provides the best outcome for the pregnant adolescent. So we have to review our nutritional goals when the client has less than nutritious dietary intake during pregnancy. So the best answer for number 8 is letter A. So of course we know that the client will gain a total of 50 pounds during the pregnancy. We don't know yet what's the weight of the patient pre-pregnancy, but as what I mentioned, we only need to have 25 to 35 pounds for the entire course of pregnancy. So the answer here is the client will eat 3 balanced meals and 2 snacks daily while pregnant because that's the acceptable expected outcome for a pregnant adolescent client, for the client to have that eating pattern. So the best answer for number 8 is letter A. Number 9. A client has obtained levonorgestrel as emergency contraception. After unprotected intercourse, the client calls the clinic to ask questions about taking the contraceptives. The nurse realizes that the client needs further explanation when she makes which statement. We're looking for a wrong answer here because we are advised to have further explanation. A. I can wait up to 4 days after intercourse to start taking this to prevent pregnancy. B. My boyfriend can buy Levonor Gestrel from the pharmacy if he is over 18 years old. The birth control works by preventing ovulation or fertilization of the egg. Or I may feel nauseated and have breast tenderness or a headache after using the contraceptives. Of course, if you're talking about your Levonor gestrel, this will actually going to reduce the chance of pregnancy if that is taken within 72 hours of unprotected intercourse and then again 12 hours later. So if we're going to talk about waiting for 4 days to take levonorgestrel reduces the effectiveness of the medication. So answer for number 9 is letter A. So males can purchase this contraceptive as long as they are over 18 years old, and this medication, the B, C, D are correct because that's a positive statement. So letter A is wrong because it should only be 72 hours or 3 days and needs to be retaken again 12 hours later after the sexual activity. Expected that there's presence of nausea, breast tenderness, vertigo, and stomach pain because that's actually the side effects of the medication. Number 9, letter A. 10. A 20-year-old multigravid client expresses a desire to learn more about the symptothermal method of family planning. Which information would the nurse include in the teaching plan? A. This method has 50% failure rate during the first year of use. Letter B. Couples must abstain from coitus for 5 days after the menses. Letter C. Cervical mucus is carefully monitored for changes. Or letter D. The male partner uses condom for significant effectiveness. Of course, we know that symptothermal method is a natural family planning method of fertility management that depends on knowing when the ovulation has occurred. So because regular menses cycles can vary 1 to 2 days in either direction, the symptothermal method requires daily basal body temperature assessment. Plus, we are also going to monitor for the presence of the cervical mucus changes. Therefore, the answer for number 10 is letter C. So, of course, the method relies on abstinence during the period of ovulation, which usually occurs approximately, that is 14 for regular, before the beginning of the next cycle. So abstinence from coitus for 5 days after menses is necessary because it is unlikely that ovulation will occur during this time. That's period days 1 to 10. So there might be ovulation that is happening already, and typically failure rate for this method is between 10 to 20% only. That's 50% is quite uh, huge already. So although condom may increase effectiveness of this method, most clients who's chosen natural methods are not interested in chemical or barrier types of family planning. So number 10, the answer is letter C. 11. After being examined and fitted for diaphragm, a 24-year-old client receives instructions about its use, which client statement indicates a need for further teaching. A. I can continue to use a diaphragm for about 2 to 3 years if I keep it protected in a case. Letter B. If I get pregnant, I will have two refitted for another diaphragm after birth. Letter C. Before inserting diaphragm, I should coat the rim with contraceptive jelly. Letter D. If I gain or lose 20 pound or 9 kilogram, I can still use the diaphragm. Further teaching is what we're looking for. Therefore, we are going to be looking for a wrong answer. Letter A. I can continue to use the diaphragm for about 2 to 3 years if I keep it protected in a case. The diaphragm can be used for 2 to 3 years, especially if it is cared for and it is well protected in its case. And then, of course, there's a need for you to have refitting for another diaphragm, especially if you have had a pregnancy and birth, because weight changes and physiologic changes of pregnancy can alter the pelvic and vaginal contours that possibly affect the effectiveness of diaphragm. And then, of course, the client should use a spermicidal jelly or cream before inserting the diaphragm. So letter uh, A, B, C are actually correct. What's wrong here is letter D, because the client would need additional instructions when she says that she can still use the diaphragm if she gains or lose 20 pounds. So if there's actually gaining or losing more than 15 pounds, that can change the pelvic and vaginal contours to such a degree that the diaphragm will no longer protect the client against pregnancy. So we have to refrain from instructing the patient about that weight gain or weight loss. 11 answer, delta. 12. A 39-year-old multi-gravid client asked a nurse for information about female sterilization with a tubal ligation, which client statement indicates effective teaching. My fallopian tube will be tied off through a small abdominal incision. Letter B, reversal of a tubal ligation is easily done with a pregnancy success rate of 80%. Letter C, after this procedure, I must abstain from intercourse for at least 3 weeks. Or letter D, both of my ovaries will be removed during the tubal ligation procedure. Of course, if you're talking about tubal ligation procedure, that is only about tying or cauterizing the fallopian tubes. So, of course, if you're talking about reversal of the tubal ligation, that's basically not easily done. And there is a pregnancy success rates after that is 30% only, but that is not 80% because that's actually quite huge already, huge percentage. And if there's tubal ligation, the client may engage in sexual intercourse for 2 to 3 days after the procedure, but not 3 weeks because that's quite long. And of course, the because we're talking about tubal ligation, it will not talk about removal of the ovaries, because if you're talking about removal of the ovaries, it should talk about oophorectomy. So answer for number 12 is letter A, because tubal ligation is a female sterilization procedure. That's a permanent procedure that involves ligation or tying off or cauterization of the fallopian tubes through a small abdominal incision, or that is on laparotomy. So 12 answer is letter A. Let's proceed now to C3, which is about newborn care, growth, and development. Number 25. A newborn who is 20 hours old, has respiratory rate of 666 beats per minute, is granting when exhaling, and has occasional nasal flaring. The newborn's temperature is 98 degree Fahrenheit or 36.6. He is breathing room air and is pink with a carcinosis. The mother had membranes that were ruptured 26 hours before birth. What nursing actions are most indicated? A. Continue recording vital signs, voiding, stooling, and eating patterns every 4 hours. Letter B, place a pulse oximeter and contact the physician care provider for a prescription to draw blood culture. Letter C, arrange a transfer to the neonatal intensive care unit with a diagnosis of possible sepsis. Letter D, draw a complete blood count with differential and feed the infant. So here we're talking about a rupture of membranes for more than 24 hours. So that could possibly increase the risk for this mother or the baby to have infection. So the concern with this infant is possible sepsis due to a prolonged rupture of membranes before birth. And therefore, it's very important for us to have blood cultures uh, that could possibly help in the accurate diagnosis of sepsis, but will take 48 hours from the time it is drawn. So therefore, there is a need for us to have frequent monitoring of the vital signs of the infant, look for changes, and at the same time maintain contact with the parents is also part of the care management while awaiting the culture results. And vital signs, voiding, stooling, and vital signs every 4 hours is considered to be standard of care for a normal newborn, but of a respiratory rate of more than 60, that is 66 breaths per minute, and there's presence of grunting and occasional flaring are considered to be not normal. So they're not normal. The need for intensive care unit is not considered to be not warranted this time because newborns with sepsis can be treated with antibiotics as the at the maternal bedside. And your CBC with will not diagnose sepsis, but if there will be changes in the white blood cells level, can actually identify an infant at risk for possible infection. So many experts suggest that waiting until an infant is 6 to 12 hours old to draw a CBC will give the most accurate results. Number 25, answer is B. Our priority here is blood culture. 27. The nurse is preparing to administer vitamin K injection to a male neonate shortly after birth. What statement by the mother indicates that she understands the purpose of the injection? A. My baby does not have the normal bacteria in his intestine to produce this vitamin. My baby is at high risk for problem involving high blood's ability to clot. Letter C. The red blood cells my baby formed during pregnancy are destroying the vitamin K. Or letter B. D. My baby's liver is not able to produce enough of this vitamin so soon after birth. So of course we know that vitamin K synthesis is going to happen in the intestine, and that begins especially if there is an intake of food, and of course we know that there's normal flora in the intestinal wall. However, at birth, the neonate's intestines are sterile, therefore vitamin K is administered by injection to prevent vitamin K deficiency that may result in possible bleeding tendency. And when it is administered, this vitamin K promotes formation of clotting factors in the liver, such as the factor number 2, factor number 7, 9, and 10. So, neonates are not normally susceptible to clotting disorders unless they are diagnosed with your hemophilia or probably having problems or deficiency with clotting factors. And then, hemolysis of fetal red blood cells does not destroy vitamin K, and hemolysis may be caused by uh, RH incompatibility or the ABO incompatibility, which leads to possible anemia and necessitates an exchange or possible blood transfusion. So, vitamin K synthesis occurs in the intestines and it is not in the liver. 26, answer is letter A. 26, letter A. Next, 27. The nurse has completed discharge teaching with new parents will be bottle feeding their normal term newborn. Which statement by the parents reflects the need for more teaching? A. Our baby will require feedings through the night for several weeks or months after birth. B. The baby should burp during and after each feeding with no projective vomiting. C. Our baby should have 1 to 3 soft form stools a day. Or letter D. We should weigh our baby daily to make sure he is gaining weight. Of course, we know that if there's presence of projectile vomiting, that will actually uh, indicate that there is pyloric stenosis and should not have been seen in a normal newborn. And then, if baby are actually bottle fed, there might be a stool 1 to 3 times daily. So it should have to be hard stool. It should not be soft. Okay, so letter C is actually wrong. And then also letter A is also wrong because uh, our Of course, it's expected that the baby should be fed uh, per demand. So by 3 months, 90% of babies are actually going to sleep through the night. Therefore, there might be adjustment that needs to be done. So number 27, the correct answer is letter D. So healthy infants are actually weighed during their visits to their healthcare provider so that it is actually necessary to monitor if there is going to be gaining weight during the entire uh, infancy. And infants may require 1 to 3 times feeding during the night initially, but as what I mentioned, there might be decreased during 3 months after. 27 is letter D. 28. After explaining to a primiparous client about the cause of her neonate's cranial molding, which statement by the mother indicates a need for further instruction. A. The molding was caused by an overlapping of the cranial bones during my labor. Letter B, the amount of molding is related to the amount and length of pressure on the head. Letter C, the molding will usually disappear in a couple of days. Or letter D, the brain damage may occur if the molding does not resolve quickly. So, of course, we know molding is going to disappear in few days without any special attention. So further instruction is what we're going to be looking for. So eliminate letter C because there's nothing wrong with it. Then you also have to eliminate also letter B because the amount of molding is related to the amount and length of pressure of the head, especially during the labor and delivery process. So letter B is also correct. And letter A is also going to be correct. What's wrong here is letter D because brain damage may occur if the molding does not resolve quickly. So the mother needs further instruction if there is a statement that molding can result in brain damage. So brain damage is highly unlikely and molding occurs during vaginal birth when the cranial bones tend to override or overlap as the head accommodates to the size of the mother's birth canal. The amount and duration of the pressure on the head influence the degree of molding, and usually molding disappears in a few days without any special attention. Answer is 28 is letter D. It will not cause any brain damage at all. 29. The nurse instructs the mother about initial breastfeeding. The client says to the nurse, "My breasts are small. Will I be able to breastfeed my baby?" Which response by the nurse is most appropriate? A. The size of your breast does not affect your ability to breastfeed. Letter B. You should attempt to breastfeed and give supplemental formula. Letter C. Bottle feeding is just as nutritious as breastfeeding. Or letter D. You can exercise. You can do exercises to increase the size of your breasts. Of course, we are trying to take into consideration here the statement of the patient about initial breastfeeding. So our best answer is, of course, the size of your breast will not be uh, will not actually increase if you're exercising, and of course, letter C is also wrong because uh, it is the bottle feeding is just as nutritious as breastfeeding. Most nutritious is of course breast milk. And then, of course, there has to be exclusive breastfeeding for the first 6 months, and breastfeeding can extend up until uh, 2 years. So, therefore, letter B is also eliminated because you should attempt to breastfeed and give supplemental formula. It should be exclusive. Answer for number 29 is letter A. So, there's a need for you to have breastfeeding because each breast consists of lobules that house the milk and secretes the cells, and the size of the breast is determined by the amount of the adipose tissue, not the milk secreting cells. Therefore, breast size has nothing to do with a woman's ability to breastfeed. Answer for 29 is letter A. 30. The client thinks it's best to give the baby formula until breast milk comes in. She tells the nurse, "I started to breastfeed my first child, but changed to bottle feeding because the baby lost lots of weight before being discharged from the hospital." Which response by the nurse is most appropriate regarding neonatal weight loss? A. It's normal for both bottle feed and breastfeed infants to lose up to 10% of birth weight during the first few days after birth. Thereby, if your baby begins bottle feeding, the infant won't be successful breastfeeding because of a preference for the nipple, for the bottle nipple. Letter C. A baby is more prone to lose weight with bottle feeding than breastfeeding. Formula is more difficult to digest. Or letter D, until the baby is ready to begin breastfeeding, you should pump your breast to promote the letdown reflex. Of course, the nurse should advise the client that it's preferable to breastfeed rather than pump the breast before, because the infant sucking stimulates production of the adequate amount of milk to meet the newborn's needs. And also breastfed newborns benefit from the colostrum initially that is present in breast milk. So the answer for number 30 is letter A. That's considered to be normal to have a weight loss of 10% of their birth weight, but gain approximately 4 to 7 ounces or 113 to 198 ounces per week in the first month after birth. And it's considered to be not necessarily true that a newborn who bottle feeds first will not successfully breastfeed because of a preference for a bottle nipple. So number 30, answer is A. Letter B is also wrong because it says it won't be successful breastfeeding because of the preference for the nipple, bottle nipple. That is not the case. 30 is letter A. 31. The nurse in a well baby clinic assesses the growth and development of healthy infants and toddlers and uses that information as a basis for teaching. Which assessment finding would the nurse considers normal for a 3-year or 3-month-old infant? Able to hold a bottle, able to lift head and shoulders, or able to roll from back to abdomen, or able to sit with support. Of course, if talking about holding a bottle that is specifically present if that is on a 4.5 months old, and then sitting with support and rolling from the abdomen to the back can actually happen after 5 months. And then, of course, if you're talking about 3 months, the best answer is letter B, able to lift head and shoulders, because in this case, especially if the baby is actually in a prone position, a 3-month-old infant should be able to raise the head and, of course, shoulders to 45 to 90 degrees. So the other development skills are accomplished later in infancy. So that is letter B, is the best answer for 31. Able to hold a bottle that is for 4 months. Able to roll from the back to the abdomen. That's actually going to be 5 months. And able to sit with support. That's 6 months and up. So 31 is letter B. 32. After a routine immunization for measles, mumps, and rubella, which one of the following should the nurse instruct the parents of a 15-month-old child to report? A. Fever that occurs within 7 to 10 days of the immunization. Rash that appears 2 to 4 days after the immunization. Crying for more than 3 hours even after comfort measures are taken. Or soreness, redness, and swelling at the injection site. So if there will be presence of crying for a long period of time, even after comfort measures have been used, so it's actually considered to be unusual and should be reported to the healthcare providers. So the other symptoms that are mentioned are usual side effects of giving MMR, which is given at 15 months and do not require notifying healthcare provider. So the best answer is if there's a prolonged crying, so it has to be reported because that is not typical response after the injection. So 32 is letter C. A, B, D are considered normal side effects. Next number 33. During a home health visit to a family with a 20-month-old child, the nurse would expect to discuss childhood safety issues with the parent when noticing which finding. Is it electrical outlets are covered? The child is eating a raw carrot stick. Furniture has rounded edges, or the child is building a tower with a large block. So options A, C, and D are considered to be measures that promote a child's safety. What is wrong here is letter B. The child is eating a raw carrot stick. So that's actually a safety concern because presence of molars, which are needed for chewing, have not yet erupted in a child of this age because a child is actually 1 year and 8 months. If the child bites large pieces of carrots or swallows a piece whole, they may obstruct the airway, or can be aspirated into the lungs. So 33, the best answer is letter B. 34. The nurse provides instructions about the proper administration of oral medications in liquid form to the parents of an infant. The nurse assumes the parents understand the medication instructions when they make which statement? A. We'll add the medication to the bottle of formula. B. We should pinch the baby's nose when we're giving the medicine. C. We'll use a rubber tip medicine dropper to give the medicine. Or D. We should give the medicine while the baby is lying down. So the answer here is letter C. So letter D is eliminated because that might actually cause this patient to have aspiration. And letter B is also eliminated because that might also increase the risk of aspiration. Because when you pinch the nose, it might be that the baby will inhale, and there's no need for you to mix that with formula because there's no guarantee that the medication will be administered if the infant does not drink all of the formula. So the best answer here is C, because the correct way to give liquid medication to an infant is to position the infant upright and slowly administer the medication using a rubber tip medicine dropper. So 34, answer is letter C. 35. Which assessment technique used by the nurse is most accurate for counting the respirations of an infant during a well child checkup? Is it count the respirations for 10 seconds and multiply it by 6? Count the respiration for 50 seconds and multiply it by 4? Count the respiration for 30 seconds and multiply by 2? Or count the respiration for 60 seconds or 1 full minute? Of course, there's no such thing as technique, no, for vital signs because it's very important for us to monitor the baby's vital signs every hour in a full minute. So the infant's respiratory rate is generally counted for 1 minute because of normal irregularities. So in assessing the older child, respirations may be counted for 30 seconds and then multiplied by 2, but that's only for an older child. But of course, that's not ideal. It should be full minute. Answer Delta. 36. Which statement by the toddler's parent to the nurse suggests that the need for further teaching about signs of readiness for toilet training? A. I won't start toilet training my child until age 18 months because sphincter control isn't usually accomplished before then. Letter B. I should begin bladder training before bowel training. Letter C. I'll wait until my child can communicate the need to go to the bathroom. Or letter D. I should wait to begin toilet training until my child can independently remove the underwear. So, of course, we know that bowel control is usually easier to accomplish than bladder control and is usually achieved first. No? All the other statements indicate a child readiness to toilet training. But what is going to be asked here is the importance of having bladder training before toilet training. So the best answer for number 36 is the best answer for number 36 is letter B because we will try to accomplish our bowel control first before bladder control. So defecation can actually be managed or controlled first before urination. So it's the other way around. It should be I should begin bowel training before bladder training because of course even if the bladder if the child is actually getting older, bladder training or bladder control is actually a bit affected. So 36, letter B. 37. The nurse instructs the parents of a 6-month-old child about the introduction of solid foods into the child's diet, which response given by the parents indicates a need for further instruction. Need for further instruction. We will begin with cereal meat for infant that is fortified with iron. We will not breastfeed or bottle feed until after solid food has been given. We will introduce one food at a time at interval of 45 days. We'll postpone giving solid food if our baby pushes it out of the mouth with the tongue. Answer here is letter B. Because of course that's wrong. A, C, and D are correct. No, we all try to start with fortified with iron. Cereals are actually expected, and we have to introduce vegetables and a 1:1 basis. And then if there will be Uh, if the baby pushes out the food out of the mouth with the tongue, it means that there's a need for us to monitor. So, of course, it needs further instruction. The best answer is letter B. We will not breastfeed or bottle feed until solid food has been given. So, that is actually a form of starving the baby. So when solid foods are introduced too early, antibodies are produced and predisposing the infant to food allergies. So it may be necessary to breastfeed or bottle feed a hungry infant before giving a solid food to relieve his or hunger and promote receptiveness to the new experience. And it is very important for us to introduce one food at a time to make it easier to identify food intolerances and at the same time allergies. And she also be given first food because they are least likely to cause food allergies and are easily to digest, and it contains iron. By age 6 months, the child will need additional iron because the iron source that are present at birth are already diminished. Answer for number 37 is letter B. Okay, thank you so much everybody for listening. See you again in our next exam.